Glaucoma group presentation. The participants of Group PAMCITE are Moisha Pope Guevara, Bernadine Marchand, Kayla McLean, Victoria Naked, Sarah O'Brien, and Danny Phillip. What is glaucoma? Glaucoma is a common eye condition where the optic nerve, which connects the eye to the brain, becomes damaged. How is it caused? It is caused by fluid buildup in the front part of the eye, which increases pressure inside the eye. Glaucoma can lead to loss of vision if it's not diagnosed and treated early. So in the diagram below, here we have a picture of, on the left hand side, healthy eyes. So the pressure inside the eye here is normal. There is no fluid buildup inside of the eye. Everything runs smoothly. In the eye infected with glaucoma, there is intraocular pressure inside the eye. There's aqueous humor, pressure inside the eyes. So the pressure is higher than normal inside of the eye. As we look closer in the normal eye, here we have no buildup, no aqueous humor fluid buildup inside the eye, no intraocular pressure, everything runs smoothly. The eye infected with glaucoma, there is buildup of aqueous humor fluid inside of the eye. The trabecular meshwork is clogged. The intraocular pressure build up until it causes damages to the optic nerve. So there are four main types of glaucoma: open angle glaucoma, angle closure glaucoma, also called closed angle glaucoma, congenital glaucoma, and secondary glaucoma. So open angle glaucoma and angle closure glaucoma, these two here being the most common. So as we go in further detail, open angle glaucoma is the most common type of glaucoma. Although the cause is unknown, the eye pressure happens slowly over time, so you cannot feel it. What it does, it pushes on the optic nerve, damaging the optic nerve that can lead to blind spots in your vision. So this type of glaucoma tends to run in the family. You are at a higher risk if you have parents or grandparents with open angle glaucoma. Also, people of African descent are also higher risk of this disease. So angle closure glaucoma occurs when the fluid is suddenly blocked and cannot flow out of the eye. This causes a quick severe risk in eye pressure. Dilating eye drops and certain medicines may trigger an acute glaucoma attack. Closed angle glaucoma is an emergency. So this type of glaucoma seek immediate care, attention, because you can go blind immediately. So if you have an acute glaucoma in one eye, you are at a risk for it in the second eye. Your healthcare provider is likely to treat your second eye to prevent a first attack in that eye. So moving on to the secondary glaucoma, it occurs due to a known cause. But open and closed angle glaucoma can be secondary when caused by something known. These causes include medicines such as corticosteroids, eye diseases such as uveitis. What is uveitis? It is an inflammation of the middle layer of the eye. Diseases such as diabetes and also eye injury. Congenital glaucoma. It occurs in babies. It often runs in the families. It is present at birth. It is caused when the eye does not develop properly. So moving on. So in the slide below, we have the causes of glaucoma. So what are the causes? The causes are high internal eye pressure, also known as intraocular pressure. Age over 55, Black, Asian, or Hispanic heritage, family history of glaucoma, certain medical conditions such as diabetes, migraines, high blood pressure, and sickle cell anemia. Corneas that are thick in the center. So on the right hand side, you'll see the development of glaucoma. So as we look, this is a picture of an eye. And as you look closer, you'll see around the iris and along the lens, and around the pupil, you'll see fluid, the aqueous humor fluid circulating in the eye. But however, the drainage canal is blocked. So when the drainage canal is blocked, the aqueous humor fluid stays inside the eye. There's no way to go. So while it's in the eye, they're circulating and swimming about. What it does, it causes high pressure inside of the eye, which is also known as intraocular pressure. So it build up, build up, build up, build up, build up. And eventually what it does, it damages the blood vessels and the optic nerve. And you know your optic nerve leads up to the brain, right? So once the optic nerve damage, you know what's going on. You can go blind, right? So moving on to symptoms of glaucoma. So we have cataract, red eye, nausea and vomiting, eye pains. So if you're experiencing any of these symptoms, you know what to do. Seek medical attention. So going on to further detail of symptoms of glaucoma. So according to Medicine Price, this is characterized by higher than normal eye pressure. So here we have the primary open angle glaucoma is the most common type of glaucoma that causes irreversible damage. The symptoms that go with this type of glaucoma is there is no pain while during physical examination, none whatsoever, and no elevated intraocular pressure at the time of examination. So the open angle glaucoma, you can get it without even knowing, right? Moving on. Further, going on to symptoms. Symptoms may be characterized by loss of vision, but the front of vision remains clear. The second type of glaucoma, which is the angle closure glaucoma, is brought on when there is no increased resistance to aqueous humor outflow from within the eye. Other symptoms of glaucoma discovered include pain, vomiting, nausea, and slow progression towards blindness, as we mentioned earlier. In normal tension glaucoma, no symptoms are present in the early stages. Gradually, blurred vision appears, and in late stages, there is a loss in sight vision. For glaucoma in children, the symptoms are a dull or cloudy eye occur, increased blinking, tears without cries, blurred vision, nearsightedness that gets worse, and a headache. For big pigmentary glaucoma, the symptoms are halos around lights, blurred vision with exercise, and gradual loss of sight vision. So you know what to do. Seek medical attention. So moving on to treatments of glaucoma, there are two types, surgical and medical treatments. Medicines. The most common type of glaucoma for surgery is called trabeculotomy. It involves removing parts of the eye drainage tubes to allow fluid to drain more easily. Glaucoma surgery may be carried out under local anesthetic, but that is while you're awake, and general anesthetic while you're asleep. For laser surgery, the focused beams of light will be used to make a small opening in the eye tissue to help drain fluid. Glaucoma surgery lowers the pressure of the fluid inside the eye. This can prevent damage to the eye and loss of vision. The surgery that will be done depends on the type and severity of the glaucoma. Moving on to medical treatments. So other types of treatments for glaucoma includes natural therapies and vitamins, which includes vitamin A, which may benefit people with open angle glaucoma. The vitamin C helps to maintain connective tissues in the eye. This type of vitamin may benefit people with open angle glaucoma. Fusculin, the next one, is a natural therapy for glaucoma that comes from the root of a plant in a mint family. It lowers the eye pressure in the people with open angle glaucoma. And finally, what we have? Rutin, which is plant pigment in some fruits and vegetables, may lower eye pressure in people with open angle glaucoma when used with fusculin. So finally,